So, Fred, let's start with the turnaround time at the state laboratory, which is really the one thing that Maine CDC can affect. We can't really affect what LabCorp does at their facility in Connecticut or Quest at their facility in North Carolina. What we can control is what the turnaround time is at the Maine CDC lab. And even within that turnaround time, what we can control is the speed with which we deliver a result, conduct the test, and provide a result from the moment the sample shows up at our front door. In that situation, but from the time a sample, a specimen, shows up at our front door to the time that a result is returned to the person who submitted it, 100% of those results now are being reported out within 48 hours. There was a small time period about a week ago where that number fell from 100% within 48 hours to 99.7%, which is the lowest it's been in the past several months. It may take time for a sample to get transported to our lab here in Augusta, depending on where it's coming from. And it may take the doctor's office who ordered the test time to get the result back to a patient. What we can control within the Maine CDC's four walls is how quickly we can take a specimen from our front door and get the result back to the healthcare provider who sent it to us. And there again, our wait time on that, our turnaround time, is 48 hours, which is what the public health authorities recommend should be the gold standard. In fact, for many of our results, our specimens, it's even lower than that. Someone that I'm very familiar with was not long ago, about a week and a half ago, able to go to a swab and send on a Monday morning, and about 25 hours later had their test results, and those were sent to the Maine CDC lab. So there's a lot of there's a lot that goes on in terms of getting a result back to a person, but within the four walls of the Maine CDC lab, that's what our turnaround time is. Now, you ask about the epidemiological value of results that come back 5 or more days after. It really does depend on whether the person is symptomatic and whether if they are symptomatic, whether they have been quarantining or not, so on and so forth. I think the bottom line here is that if you think you have been exposed to COVID-19 and you wish to get tested, as I noted at the top of the briefing, we recommend that. However, if you have been exposed or you think you've been exposed to COVID-19 and you wish to get tested, which we recommend, your part of the bargain there is to remain in quarantine until you get your results. If you've been a close contact of somebody who is COVID-19 positive, meaning you've been in touch with them for more than 15 minutes within 6 feet, you've got to be in quarantine irrespective of what your test results are. If you were a casual contact and you're concerned, you can get tested, but you still have to be in quarantine, because even a result that comes back a couple of hours later still means you could have exposed other people. So the key here is making sure folks who are getting tested stay indoors in quarantine, not exposing other people while they're awaiting their result. And if they are a close contact, they have to be in quarantine for the entire 14 days.